Alrighty, chaps, we're back here, and it's kind of a half British, half Australian accent. So we're just gonna go back to our native tongue here, if you will. So in this video, we're gonna look at an example of the whole parasympathetic, sympathetic nerves coming into play, and the parasympathetic, sympathetic nervous systems coming into play. We're gonna look at agonists, antagonists, and some examples of those as well, so that helps all pieces together. And we're also gonna talk a little bit about nicotine too. So we all know about nicotine, and we'll talk about that in a moment. But so for instance, with the parasympathetic region of the autonomic nervous system, we already talked about this. The ACH is going to be secreted by the preganglionic neuron, which binds to the nicotinic receptor of the postganglionic neuron, the cell body, which causes ACH to be secreted, which will bind to the muscarinic receptor of the effector. However, with the sympathetic region of the autonomic nervous system, the preganglionic neuron will still secrete ACH. It'll still bind. The ACH will still bind to the nicotinic receptor of the cell body of the postganglionic neuron, which will cause norepinephrine to be secreted by the postganglionic neuron of the sympathetic portion, which will bind to either an alpha receptor or a beta receptor on the effector. So the effector in this case would be the heart. So if there's more parasympathetic information being sent to the heart, there's going to be a parasympathetic response. However, if more sympathetic information is more sympathetic nerve impulses are being sent to the heart, there's going to be a sympathetic response. So in this instance, the more ACH that binds to the muscarinic receptor, the heart rate's going to decrease. However, if more norepinephrine binds to the alpha or beta receptors on the heart of the sympathetic portion of the heart rate's going to increase. So it's pretty cool how whether the more ACH binds or more norepinephrine binds is which ultimately going to cause the heart rate to increase or decrease, and obviously all the other sympathetic and parasympathetic responses too. It's kind of an all or nothing. If with a sympathetic response, if the heart rate increases, the respiratory rate's going to increase, and so on and so forth, and that's due to the sympathetic chain. I'm actually not sure if that's exactly true with the parasympathetic nervous system, but I would like to think so. I'd like to think with a parasympathetic response, the pupils are going to constrict, the heart rate's going to decrease, the respiratory rate's going to decrease, and so on and so forth. So rule of thumb is obviously one. If there's more norepinephrine, all of the sympathetic responses are going to come into play, where if there's more ACH binding to the muscarinic receptor on the heart, there's going to be a more parasympathetic response, put it that way. So now we got that little example presented here. Let's discuss agonists and antagonists. So an agonist promotes a natural occurring reaction in the body, where an antagonist opposes actually a natural recurring reaction in the body. So agonist promotes a naturally occurring reaction in the body. Antagonist opposes naturally occurring reaction in the body. Don't know why I keep saying recurring there, but just think like an antagonist in the movie. It's the bad guy, it's the villain. It opposes the natural occurring reaction, and by the main character in a movie, or in this case, by the naturally occurring reaction in the body. So many drugs administered are either cholinergic agonists, cholinergic antagonists, which are parasympathetic medicines, where sympathetic medications would be adrenergic agonists and adrenergic antagonists. So we learned about the cholinergic and adrenergic receptors in I think it was the previous video, or one of the couple previous videos here. But the cholinergic receptors, the ACH, will bind to the muscarinic receptor. So obviously it'll bind to the nicotinic receptor, but also the muscarinic receptor on the effector, where the adrenergic receptor, the norepinephrine secreted by the postganglionic neuron, will bind to either an alpha or a beta receptor on the effector. So same thing with the cholinergic and adrenergic agonists and antagonists. The So cholinergic agonists would obviously increase the amount of ACH binding to the muscarinic receptor. Cholinergic antagonists would decrease the amount of ACH binding to the muscarinic receptor. Where with a adrenergic agonist, more norepinephrine would be able to bind to the alpha or beta receptors on the heart in this example, or adrenergic antagonists, less norepinephrine would be able to bind to the alpha or beta receptors on the heart. So an example of a adrenergic antagonist would be a beta blocker, for instance. So a beta blocker blocks the beta receptors. So if the beta receptors are blocked, guess what? The norepinephrine has nowhere to bind, so the norepinephrine can't have an effect. So the adrenergic antagonist, the beta blocker, opposes the naturally occurring reaction in the body. So the natural occurring reaction in the body is the norepinephrine binding to the alpha or beta receptor. However, in this case, beta receptor is blocked, so that natural occurring reaction in the body is opposed by this beta blocker. So beta blocker blocks the beta receptor, norepinephrine can't bind, so obviously there's going to be an opposition to that naturally occurring reaction in the body. However, let's say with a cholinergic or I guess a muscarinic blocker, I'm not even sure if that's such a thing, there would be less ACH binding to the muscarinic receptor, since obviously the muscarinic receptor is blocked, so there'd be less of effect. This would be in cholinergic antagonist. And then obviously the vice versa would happen with the agonist of cholinergic agonists or adrenergic agonists. So cholinergic agonists, obviously ACH, the heart rate would decrease and all the parasympathetic responses would be activated because more ACH would be binding to muscarinic receptors, so the ACH would ultimately have the greater effect on the body. And same with if there was an adrenergic agonist, which there are, more norepinephrine would be binding to alpha or beta receptors, which would ultimately cause heart rate to increase, all the sympathetic responses to also be activated as well. So that's the agonist and antagonist. Pretty self-explanatory, pretty straightforward. Agonist promotes a naturally occurring reaction, where an antagonist opposes a naturally occurring reaction. And I wanted to finish this video off by discussing nicotinic receptors. So nicotine's pretty awesome drug, actually. It's highly addictive, so just be aware of that. But the function in the body is pretty magnificent. So nicotine obviously binds to nicotinic receptors. Duh. So nicotine can actually, the binding to a nicotinic receptor can stimulate a parasympathetic or a sympathetic response. So with most of these neurotransmitters, like the ACH, can only really stimulate a parasympathetic response. Norepinephrine can only stimulate a sympathetic response. Nicotine's different. It can stimulate whatever really one it chooses at the specific time in the body. So if there's more parasympathetic activity than sympathetic, nicotine's going to stimulate a sympathetic response to bring the body to homeostasis, and vice versa. If there's more sympathetic activity in the body than parasympathetic activity, the nicotine would have a parasympathetic response, so it would cause the heart rate to decrease, the respiratory rate to decrease, so on and so forth. So that's why a lot of smokers do have a coffee and a cigarette in the morning, because the nicotine will bind to the nicotine receptor, obviously, when smoked, and it'll sometimes activate the sympathetic response to kind of boost, give a pick-me-up, if you will, for the day. And it also can activate that parasympathetic response to, if you notice, a lot of smokers, they need a cigarette, if you will, to calm down. That's due to the nicotine binding to the nicotinic receptor, and in that instance, causing a parasympathetic response, where a smoker gets up in the morning, lights a cigarette. The nicotine will cause a sympathetic response because their sympathetic nervous system's less activated at that certain point in time.